Hello everyone and welcome back to my channel. We'll be going through some practice questions and answers for the Certified Nursing Assistant exam. Question 1. What is the most important thing a CNA should do when assisting a resident to transfer from a bed to a wheelchair? A. Ask the resident if they are ready. B. Lock the bed wheels and wheelchair. C. Use only one caregiver for assistance. D. Raise the bed to the highest level. While it is important to communicate with the resident, this is not the priority because while moving the resident, you have to ensure that all safety measures are in place. That will bring us to option B. Locking the bed wheels and wheelchair is a crucial safety step when assisting a resident with a transfer. This ensures stability and prevents the bed or wheelchair from moving during the transfer, thereby reducing the risk of falls or injury for both the resident and the certified nursing assistant. In option C, the number of caregivers required for assistance depends on the resident's mobility and condition. However, this is not the primary action in ensuring safety during the transfer. In option D, the bed should be adjusted to an appropriate height for the CNA's comfort and the resident's safety, but the priority is to ensure that the wheels are locked before beginning the transfer. This makes our answer option B. The most important thing is to lock the bed wheels and wheelchair to ensure stability and prevent the bed or wheelchair from moving during the transfer. Question 2. A resident has been prescribed a special diet to help control blood sugar. Which of the following actions should the CNA take? A. Make sure the resident drinks extra fluids. B. Encourage the residents to eat whatever they want. C. Observe the resident's food intake and report any concerns to the nurse. D. Allow the resident to skip meals if they feel full. While hydration is important, a special diet to control blood sugar may have specific guidelines regarding fluid intake, so extra fluids may not always be recommended. The CNA should follow the specific instructions given by the healthcare provider. In option B, this totally goes against the purpose of the prescribed diet. Encouraging the resident to eat whatever they want could disrupt the management of blood sugar levels, which is the reason for the special diet in the first place. As a CNA, it is essential to monitor the resident's adherence to the prescribed diet and report any concerns to the nurse. This includes ensuring that the resident is following the dietary plan to help manage their blood sugar levels effectively. If there are any signs that the resident is not following the diet, such as refusing food or consuming items not on the prescribed plan, this should be reported. In option D, skipping meals could negatively affect blood sugar control. The residents need to follow the prescribed eating schedule and diet, and if they have any concerns about fullness or appetite, those should be reported to the nurse. So the action the CNA should take is option C. Observe the resident's food intake and report any concerns to the nurse. Question 3. When caring for a resident who is incontinent, which of the following actions is the CNA's top priority? A. Encourage fluid intake to prevent dehydration. B. Provide regular toileting to reduce the risk of skin breakdown. C. Apply an adult brief before every meal. D. Keep the resident's room well ventilated. While encouraging hydration is important, this is not the priority. Fluid intake should be managed based on an individual's needs and medical guidance. For residents who are incontinent, one of the top priorities is to reduce the risk of skin breakdown by ensuring that they are regularly toileted or have their briefs changed as necessary. Prolonged exposure to moisture from incontinence can lead to skin irritation, sores, and infection, so frequent toileting and maintaining cleanliness is crucial. In option C, applying a brief before meals may not be the best approach, as it is more important to address the residents' toileting needs based on their specific schedule and condition, rather than a fixed schedule like meal times. Ventilation is important for general comfort, but it doesn't directly address the key concern of skin integrity for an incontinent resident. So, the primary concern is managing incontinence to prevent skin breakdown. This makes our answer option B, providing regular toileting to reduce the risk of skin breakdown. Question 4. The Heimlich maneuver uses abdominal thrusts to A. Get air into the lungs. B. Open the airway. C. Remove the blockage from the airway. D. Start the heart beating. While the Heimlich maneuver may result in air being pushed into the lungs during the expulsion of the obstruction, its primary purpose is not to get air into the lungs. In option B, the Heimlich maneuver does not directly open the airway, rather it removes a physical blockage from the airway. So, looking at option C, this is likely the answer. The Heimlich maneuver involves using abdominal thrusts to expel air from the lungs with force, which helps to dislodge a blockage from the airway, such as food or another object. This technique is used in emergency situations when someone is choking and unable to breathe because their airway is obstructed. The Heimlich maneuver is not used for starting the heart. This is not used for cardiac arrest. If someone is not breathing or has no pulse, CPR will be the appropriate response. So with respect to the question that we have, the answer is option C. It is used to remove a blockage from the airway. Question 5. What should the CNA do to ensure that a resident does not get dehydrated? A. Discourage residents from drinking when they are tired. B. Tell the resident to drink fluids only when they are told to. C. Only let the residents drink fluids when they are eating. D. Provide fresh water and other fluids on each shift. Encouraging hydration is important regardless of whether the resident is tired, so our answer is not option A. In option B, fluid intake should not be restricted to only when they are told. Rather, encouraging regular access to fluid will help to prevent dehydration before it becomes an issue. Option C, restricting fluid intake to mealtimes may lead to dehydration, especially if the resident doesn't feel thirsty or has a reduced appetite. So this makes our answer option D. To prevent dehydration, the CNA should ensure that fresh water and other fluids are readily available to the resident throughout the day. Encouraging regular fluid intake, even when the resident is not eating, will help to maintain hydration and support overall health. Question 6. When providing oral care to an unconscious resident, the CNA should A. Use a tongue depressor to clean the teeth. B. Place the resident in a sitting position. C. Use a sponge-tipped applicator and check for choking hazards. D. Clean the mouth quickly without removing any dentures. In option A, a tongue depressor is not typically used for cleaning teeth. It is usually a tool for examination or for holding the tongue in place. It can also be uncomfortable or unsafe for oral care in unconscious residents or patients. In option B, unconscious residents, it may not be safe or possible to place them in a sitting position. Instead, the CNA should ensure that the resident is positioned appropriately, which it will be usually on their side, in order to prevent aspiration and allow for easier access to the mouth. So this brings us to option C. When providing oral care to an unconscious resident, it is important to use a sponge-tipped applicator because it is gentler and safer for cleaning the mouth. Additionally, checking for choking hazards is critical, so ensure that no debris or foreign objects are left in the mouth that could cause harm or block the airway. In option D, cleaning the mouth quickly is not recommended as oral care should be thorough and gentle. Additionally, dentures should be removed for cleaning to ensure proper hygiene and prevent damage to the dentures or gums. This makes our answer option C. When providing oral care to an unconscious resident, it is important to use a sponge-tipped applicator because it is gentler and safer for cleaning the mouth. Question 7. If a resident has not had a bowel movement in several days, she may complain about A. Nausea, B. Decreased appetite, C. Abdominal cramps, D. All of the above. If a resident has not had a bowel movement in several days, they may experience a range of symptoms, and this usually includes nausea, decreased appetite, and abdominal cramps. So this makes our answer option D, all of the above. Nausea is the feeling of discomfort in the stomach, which may result from a buildup of waste in the intestines. Decreased appetite is also as a result of the digestive system not functioning properly. The residents may not feel like eating. Constipation also causes discomfort and cramping in the abdomen due to the buildup of stool in the intestines. So, if a resident has not had a bowel movement in several days, she may complain about all of the above: nausea, decreased appetite, and abdominal cramps. Question 8. When measuring a resident's weight, which of the following actions is correct? A. Weigh the resident in the morning before breakfast and after using the bathroom. B. Weigh the resident at any time of day for convenience. C. Use the resident's wheelchair to measure their weight. D. Weigh the resident only if they ask for assistance. For accurate weight measurement, it is important to weigh the resident consistently at the same time each day. This will be ideally in the morning before breakfast and after using the bathroom. This minimizes fluctuations due to food or fluid intake, and it will provide the most accurate results. We would not be going with the other options. In option B, weighing a resident at different times of the day can lead to inaccurate readings because weight can fluctuate due to food or fluid intake. Also, while some devices allow weighing in a wheelchair, it is more accurate to use a standard scale. Weighing the resident in a wheelchair can give misleading results due to the weight of the wheelchair itself. Finally, the CNA should weigh the resident based on the care plan or if weight monitoring is needed, not only when requested. So, regular monitoring may be necessary for health or medical reason. So, out of these options, our answer is option A. The best time is to weigh the resident in the morning before breakfast and after using the bathroom in order to get an accurate reading. Question 9. When responding to a patient on the intercom, what should you do? A. Ask for the patient's name. B. Say, "May I help you?" C. Give your name and position. D. Say, "The nurse will answer your call." When responding to a patient on the intercom, it is important to identify yourself by giving your name and position. This helps the patient to know who they are speaking with, thereby creating a sense of trust and clarity in the communication process. So our answer is option C. Question 10. Which of the following is a common sign of a stroke? A. Sudden loss of vision in one eye. B. Sudden confusion, trouble speaking, or understanding speech. C. Sudden pain in the chest. D. Sudden numbness or tingling in the legs. For option A, while vision loss can sometimes occur during the stroke, it is more often associated with specific types of stroke, such as those affecting the visual cortex. A stroke can cause sudden or severe changes in speech and understanding, often leading to confusion, difficulty speaking, or difficulty understanding others. These symptoms occur because a stroke affects areas of the brain responsible for language and communication. In option C, chest pain is more commonly associated with a heart attack, not a stroke. However, both conditions can occur simultaneously or they can be mistaken for each other. In option D, while numbness or tingling can be a sign of stroke, it is more commonly observed in one side of the body and can be accompanied by weakness or paralysis. Confusion and speech difficulties are more definitive signs. That's why we'll be going with option B. Sudden confusion, trouble speaking, or understanding speech. This is because the stroke affects areas of the brain that are responsible for language and communication. Question 11. A resident with Alzheimer's disease is frequently trying to leave the facility. What should the CNA do? A. Allow the resident to leave and follow them. B. Tell the resident they cannot leave and physically block the door. C. Try to distract the resident with a comforting activity and report the behavior. D. Lock the door to prevent the resident from leaving. Allowing the resident to leave can pose a safety risk. The resident might wander into dangerous areas or get lost, and this is especially concerning for those with Alzheimer's. So it is important to ensure their safety at all times. In option B, telling the resident they cannot leave or physically blocking the door can lead to escalating the situation, and this can cause distress for the residents. Physically blocking the door may even increase agitation and confusion. Residents with Alzheimer's disease may exhibit behaviors such as attempting to leave the facility due to confusion or a need for comfort. The best approach is to distract the residents with a comforting activity, such as engaging them in conversation, offering a familiar object, or involving them in a calm activity. It is also important to report the behavior to ensure proper care is provided and that the resident's safety is closely monitored. In option D, while locking the door might prevent the resident from leaving, it is not an ideal solution. It can make the resident feel trapped or anxious, so it is important to follow the facility's policies on safety and supervision. So the best thing to do in this situation would be option C. Try to distract the residents with a comforting activity and then report the behavior. Question 12. How should a CNA respond if a resident refuses to take a bath? A. Ignore the resident's wishes and proceed with the bath. B. Respect the resident's refusal and inform the nurse. C. Force the resident to take the bath for hygiene purposes. D. Attempt to trick the resident into taking a bath. Option A can be seen as disrespectful and a violation of the resident's autonomy, and this can cause increased agitation and distress. If a resident refuses to take a bath, the CNA should respect the resident's wishes and inform the nurse. It is important to maintain the resident's dignity and autonomy. So if a resident refuses care, it should be documented and communicated to the nurse, who can assess the situation and determine the best course of action. In option C, forcing a resident to take a bath can cause physical and emotional harm and may lead to increased resistance. So it is essential to approach situations like this with patience and respect. In option D, trying to trick a resident into taking a bath can be manipulative and unethical. It is important to have open and respectful communication and try to address the underlying reasons for refusal. So the best way a CNA should respond if a resident refuses to take a bath is option B. Respect the resident's refusal and inform the nurse. Question 13. As a safety measure, when giving mouth care to an unconscious patient, in what position should you place the patient? A. In a semi-fowler position. B. On their back. C. In the supine position. D. With the head turned to the side. While the semi-fowler position is often used for comfort or during certain procedures, it is not ideal for mouth care in unconscious patients because it increases the risk of aspiration. Similarly, in option B, placing the patient on their back can increase the risk of aspiration because fluids could flow into the throat or airway. In option C, the supine position, which is also laying flat on their back, is not recommended for unconscious patients during mouth care because it can increase the risk of aspiration. When providing mouth care to an unconscious patient, it is important to turn the patient's head to the side in order to prevent aspiration, which is the inhalation of fluids or debris into the lungs. And this can reduce, by turning their head to the side, this can reduce the risk of choking. This position allows any fluid or debris to drain out of the mouth rather than being swallowed or inhaled. So our answer here is option D. Question 14. Which of the following is the best way for a nursing assistant to prevent the spread of infection? A. Wearing gloves at all times. B. Washing hands frequently and properly. C. Avoiding contact with all patients. D. Using hand sanitizer instead of washing hands. Hand hygiene is the most effective way to prevent the spread of infection in healthcare settings. So, proper hand washing with soap and water removes germs, bacteria, and viruses that can cause infections. Looking at the options, while wearing gloves in option A can provide protection, they must be changed frequently and they do not replace hand washing. Also, avoiding patient contact is not practical for a nursing assistant, and using hand sanitizer is helpful, but it is not a complete substitute for washing hands, especially when hands are visibly soiled. So the best way for a nursing assistant to prevent the spread of infection is by washing their hands frequently and properly. Question 15. When a resident is on a clear liquid diet, which of the following foods is appropriate to serve? A. Scrambled eggs. B. Mashed potatoes. C. Chicken broth. D. Vanilla pudding. Scrambled eggs and mashed potatoes are solid foods and they are not allowed on a clear liquid diet. Vanilla pudding is not a clear liquid because it is opaque and it contains dairy, which is inappropriate for a clear liquid diet. So chicken broth is a clear liquid and it is suitable for this type of diet. A clear liquid diet consists of transparent fluids that leaves little to no residue in the digestive system. This diet is usually prescribed before or after surgery for digestive issues or for medical procedures. So acceptable options include water, broth, clear juices, and gelatin. So our answer here is option C. Question 16. When a resident with Alzheimer's disease becomes agitated and starts yelling, what is the best action for the nursing assistant to take? A. Restrain the resident to prevent harm. B. Speak in a clear and calm, reassuring manner. D. Shout back to establish authority. D. Leave the resident alone until they calm down. Residents with Alzheimer's disease may experience agitation, confusion, and frustration. The best approach would be to remain calm and use a reassuring tone in order to help de-escalate the situation. That will be option B. Physically restraining the resident should be a last resort and it should only be done under a doctor's order because this can increase distress and agitation. Shouting back is not an option because this will likely escalate the situation and make the residents even more agitated. Leaving the residents alone as well could cause feelings of fear, abandonment, or increased confusion. So a calm, patient, and supportive approach will help to create a safe and comfortable environment for residents with Alzheimer's disease. Question 17. A nursing assistant finds a resident crying in their room. What should the nursing assistant do first? A. Tell the resident to stop crying. B. Leave the room to give the residents privacy. C. Sit with the resident and ask if they would like to talk. D. Report the resident's behavior immediately to a nurse. Option A is dismissive and it does not acknowledge their feelings, so this might even make the residents feel worse. While privacy is important, suddenly leaving may make the residents feel isolated or abandoned. A nursing assistant's role involves providing emotional support to residents. So if a resident is crying, the best approach is to show compassion and active listening by sitting with them and gently asking if they would like to talk. In option D, while concerns should be reported if necessary, the first thing the CNA should try to do is to comfort and assess the resident's emotional state. So that makes our answer option C. If the resident is crying, the best approach is to show compassion and active listening by sitting with them and gently asking if they would like to talk. Question 18. A resident who has not had a bowel movement in 3 days complains of stomach discomfort. What should the nursing assistant do? A. Give the resident a laxative. B. Encourage the resident to drink more fluids and eat fiber-rich foods. C. Ignore it. This is normal for some residents. D. Call the resident's family for advice. In option A, CNAs are not authorized to give medication, including laxatives. Only a nurse or doctor can make that decision. Constipation is a common issue in elderly residents, and hydration and fiber intake are natural ways to promote bowel movement. So, encouraging the resident to drink more water, eat fiber-rich foods like fruits, vegetables, and whole grains, and staying active can help to relieve constipation. In option C, while occasional constipation may be normal, it should never be ignored, especially if the resident is uncomfortable. And in option D, medical concerns should be reported to the nurse and not to the resident's family, because the nurse is responsible for assessing and addressing health issues. So the best option is option B. Encourage the resident to drink more fluids and eat fiber-rich foods. Question 19. Which of the following is the best way for a nursing assistant to communicate with a resident who has hearing loss? A. Speak clearly and slowly while facing the resident. B. Speak very loudly and exaggerate words. C. Only communicate with the resident in writing. D. Avoid speaking to the resident to prevent frustration. For residents with hearing loss, it is most effective to speak clearly and slowly, ensuring that you face them directly. This will help the resident to read your lips and better interpret your words, thereby enhancing communication. In option B, speaking too loudly or exaggerating words can distort the message and make it more difficult to understand. In option C, while writing can be helpful, it is not always the best or most practical options. Verbal communication with clear speech should be prioritized, with writing used as a supplement when needed. In option D, avoiding communication can leave the residents feeling isolated and frustrated, so it is important to find other ways to communicate effectively. So the best way is option A. Speak clearly and slowly while facing the residents. Question 20. A nursing assistant notices a resident clutching their throats and unable to speak. What should the nursing assistants do first? A. Encourage the resident to cough forcefully. B. Perform the Heimlich maneuver. C. Offer the resident a glass of water. D. Call the resident's family for help. A resident clutching their throat and unable to speak is showing signs of choking, so the CNA should immediately perform the Heimlich maneuver in order to clear the airway. Encouraging coughing is only for mild airway blockage, that is when the person is still able to breathe or speak. A choking person cannot swallow, so you cannot be offering them water. And then, medical emergencies require immediate action and not waiting for family intervention. So the best thing to do, or rather the first thing to do, would be option B. Performing the Heimlich maneuver. This brings us to the end of the practice questions for the Certified Nursing Assistant Certification Exam. Don't forget to like, comment, and share. And also hit the subscribe button so that you'll be informed when our next informative video will be dropping. Thank you for watching, and I'll see you in the next one.